Hello and a very good evening to all our viewers who are joining me on this Facebook and YouTube live interaction of News 9. And today I will be speaking about why states across the country are taking up sero surveys, and also about how it is done, and also about the importance of sero surveys in India. But before that, let me give you a quick update on the sero survey exercise that is being conducted across the country now. With a name to map and understand the spread of the novel coronavirus, Assam's first sero survey was launched in its largest city, which is Guwahati, today. And the Indian Council of Medical Research, or the ICMR, has started the second phase of sero surveillance study in Kerala in order to ascertain the extent of spread of COVID-19. And the survey began today, and it will cover Palakkad, Thrissur and Ernakulam districts, and these districts have already been covered during the first phase of the sero surveillance. Well, sero surveillance survey is conducted in order to diagnose infections, autoimmune illnesses, and it can also be conducted to check if a person has developed an immunity towards certain diseases. Delhi, for example, has conducted two sero surveys, and thus so far and will carry out such sero surveys every single month. So the first of every month till a certain number of days, they will be conducting the sero surveys, and after every sero survey is conducted, the results will be analyzed, and based on that, there will be facilities that will be provided for the COVID-19 situation in that particular state. So it has started in Delhi, and today it started in Guwahati, which saw close to 90,000 cases overall. And so the government has now started the sero exercise, and today was the first day of the sero exercise, whereas in Kerala, the second phase of the sero exercise has started today. So the first survey was conducted in Delhi from July 27 to July 10th, and found that around 23% of the people have antibodies against COVID-19. And the second one, meanwhile, was conducted from August 1st to August 7th, like I mentioned earlier. And that particular survey, sero survey, found that 29% had developed antibodies against the Chinese-born infection. So as of August 22nd, Assam has reported a total of close to 90,000 coronavirus cases, and this also includes 67,641 discharges with close to 21,590 active cases, and also 234 deaths, along with 3 cases of migration from the state were also witnessed in Assam. So with over 23,000 cases, Guwahati is now the worst hit city in Assam as well as in Northeast India. So now you might wonder why sero survey and how important sero survey is given the kind of population that is present in India. Well, sero survey is basically a more focused population based survey of high and low risk groups in the districts, and they will be selected for testing. And this move will not only help the government and its agencies to monitor COVID-19 trends, but also will help the health officials to check whether community transmission is present in that part of the country. So the health ministry has so far maintained that there is a slight evidence of community transmission in the country, and so in order to curb the large outbreaks, sero survey is being taken up in the country. Now you might wonder how sero surveys are usually done. Well, the enhanced exercise will see close to 10 facilities, which include 6 public and 4 private from each district being tested. So for the sero survey, population groups will consist of low as well as high risk population groups, and the low risk group will include outpatient attendees and even pregnant women, while the healthcare workers will be surveyed among the high risk population, because they are directly exposed to the virus, because as they treat COVID-19 patients on a daily basis. So healthcare workers are considered to be part of the high risk population, which will be tested separately from the low risk population. Now this particular survey will include a total of 200 samples per week and 800 samples every month, and this particular survey will include at least 100 samples per week and 400 samples per month from the selected districts from the high risk population, whereas that was for the low risk. And for low risk population, 50 samples per week and 200 per month will be collected from the outpatient attendees and also pregnant women. So the agencies will use a combination of RT-PCR and ELISA antibody kits for these particular surveys. And during the testing, throat swabs and even nasal swabs will be collected for RT-PCR tests, and the samples will be tested in a one-time pool of about 25. But however, the results of this sample pooling are only for surveillance purposes, and they cannot be used for diagnosing a particular patient. So, in order to, what I wanted to say was that with a serosurvey result report, you cannot go to a hospital and say that, I don't have antibodies present in my particular body, so for me to fight COVID-19, I'll need antibodies. Well, there are reports which suggested that the antibodies will wane after a certain period of time for recovered patients, and in order to not diagnose patients on this particular report, which is for a temporary basis, that is only for a period of time. The serosurvey is collected from samples for a period of time to understand how much antibodies they had in them to fight COVID-19. So these antibodies might wane away. So in order to get ourselves tested, we shouldn't use the serosurvey report. So, and also in subsequent rounds of testing, IgG ELISA based testing of samples will also replace the RT-PCR based testing for surveillance purposes. But when it comes to Karnataka, there seems to be a delay. And you might ask, why haven't we started serosurvey yet, given the kind of cases that are present in the state? Because Karnataka has crossed 1 lakh cases, and the situation seems to be getting worse with each passing day. So after Delhi and Pune, Karnataka will also be conducting a serological survey across all the districts in order to estimate the prevalence of COVID-19 across the state and the proportion of the people who have developed immunity towards this particular virus. And this survey, which will involve adults over the age of 18, will cover close to 38 units, including all the districts of Karnataka and 8 zones of the BBMP. Health Commissioner Pankaj Kumar Pandey started the training purposes for the Sero survey from Thursday. So the district surveillance officers, district tuberculosis officers, and many other important epidemiologists and integrated counseling and testing centers under National AIDS Control Organization were also part of the training. And this particular survey data is expected to guide the state's inventions for COVID-19 management. And this survey will also include samples from populations at 3 risk levels. Low risk populations include pregnant women at antenatal checkup clinics, and also persons attending the outpatient department in hospitals or attendees of children or patients. So the moderate to high risk population, which is the second population group which will be tested, will include bus conductors, vegetable vendors, healthcare workers, individuals in containment zones, and individuals in meeting areas such as markets, malls, bus stops, and even railway station. Whereas the high risk population will include the elderly and also the vulnerable group of population with comorbid conditions, who will be very vulnerable to COVID-19, because most of the victims who have succumbed to this virus are said to be the older people with comorbidities like diabetes and respiratory problems and such other ailments, and these ailments will put them under severe risk. So this is the third population of people who will be tested during the Sero survey. Well, Sero survey has begun across the country. In Delhi, Pune, Guwahati saw its first day of Sero testing today, and Kerala has stepped into the second phase of Sero survey. So Karnataka, when it comes to Karnataka, there seems to be a slight delay. The training purposes are on. The state health officials are being trained for Sero survey, and in the coming days or the nearest future, we could also see Sero survey exercise, which will be kick-started in Karnataka as well. So until then, all we request our viewers to do is to stay safe wherever they go, and to also follow all the safety and precautionary measures in order to stay safe from COVID-19, because we don't have a vaccine yet. So sanitizers and face masks are the only weapons which we can use to fight COVID-19. So that is the wrap of this live interaction session with you guys. And until next time, please stay safe and also take all the safety and precautionary measures.